So I tell patients all the time, we have to make you dizzy in order to find out what's making you dizzy.
Got it.
And so the reason that you get dizzy during some of these evaluations is because something is disordered.
Sure.
Right? If you had a perfectly functional vestibular system, you wouldn't have any reaction to the testing.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Welcome back to a brand new episode of Ask an Audiologist. I am Kevin Ziener.
And I am Dr. Michael Squires.
And there is nobody better to have on this podcast than the gentleman who personifies balance than Dr. Michael, because this week is Balance Awareness Week. And in the spirit of that, we want to talk about vestibular.
Yep.
Now, what does vestibular mean? I know what it means because I've just picked it up through osmosis from Dr. Michael. But Dr. Michael, for everybody else who isn't nearly as well educated as you and I are, can you explain to us what vestibular means and why we are talking about it on Balance Awareness Week?
Yep. Well, our entire purpose here is to increase awareness.
Yes.
And so be aware of balance.
Yes.
Right? So the way that I describe it to patients is in order for you to stand up, move around, not fall over, three things have to happen.
Okay.
Right. So you have to have good visual input.
You have to have legs.
You got check one.
Okay, I got it.
You got to have some legs, which is actually to my next point. So you have to have good visual input, which obviously that's going to go through ophthalmology and optometry.
Yep.
You have to have good proprioception, which is your body's ability to figure out what's happening when you're contacting. I knocked the whole stage.
Say that one more time. What's the word?
Proprioception.
Proprioception.
Yeah,
I was going to say that, but I'm happy you said that.
Yeah. That's okay. I just beat you to it.
Yeah.
Your body has to know what's happening when your feet are touching the floor. So for patients who are diabetic, for example, they might have some diabetic neuropathies in their feet. That is going to decrease their proprioceptive abilities, which can lead into some of those fall risks that we talk about a lot.
Okay.
And then you have to have good vestibular input.
Okay.
So from our perspective as an audiologist, vestibular input is what your inner ears are doing to tell your brain what is happening. So it's angular motion, acceleration, and that sort of things. You've got several organs in your inner ear that tell your brain what's happening. And that's what we're testing when we are doing vestibular assessments.
Got it. So I think probably a lot of people who first go to an audiologist or understand how their hearing is related to balance, it's a bit of a shock because you would actually think it's just your brain chemistry is off, or you're suffering from vertigo, which is some outside affliction, perpetuating it on you, as opposed to the issue being internal. Of those three elements that you laid out, where do the ears rank on the importance level, or the happenings within the ears as it relates to balance? Because I've, now that I kind of am aware of it, assumed that it was the predominant factor as to whether or not your balance is going to be correct.
Yeah, it's definitely the predominant factor in what we consider vestibular, right? Yeah. We as audiologists, again, we are Ask an Audiologist podcast. So the way that I look at it is your central vestibular system, which is like your brain, can overwrite some of these rules. So think about it this way, okay? When you're a baby, no babies can sit up. It's because they have not developed the skills in order to do so. So think about your brain as like a CPU, like a computer.
Sure.
And each of our vestibular inputs are a little file. Okay. So you think about it, you've got a baby, can't walk, can't crawl, can't do anything like that. It's just kind of laying there. And as the brain develops, it starts to store some of these files. So eventually the baby can sit up and crawl. They can keep their head up. They can move around like this. But we all know the babies that are sitting there and you roll a ball past them and they go, right, and fall over. It's because they don't have that file yet. You do that enough, they get some habituation, and then they overcome that. And then their brain learns what to do with the vestibular input that it's getting. Yeah. So as we get older, in theory, we're accumulating all of these files. And as we accumulate those files, now we are, like most people, able to get up and move around.
Got it.
sometimes those files get corrupted, just like in our everyday computers, right? And what that can be is some type of vestibular disorder, like labyrinthitis, for example, or Meniere's disease, for example.
Labyrinthitis, when you watch too much of the Labyrinth movie with David Bowie.
Yeah,
that's
absolutely.
Labyrinthitis.
Yeah, and then you sit there too long and your brain doesn't know what to do with that input anymore.
Right. It's too much David Bowie.
Way
Too much David Bowie, way too
much.
many puppets from Jim Henson.
Yeah, clearly.
That's my self-diagnosed
that's
labyrinthitis.
The premise of the whole movie,
Yeah.
right? Too many puppets.
Too many puppets.
So whenever you have these files that are deleted, you can rehabilitate that through some vestibular therapy. Generally, that's done either by an audiologist or more specifically a physical therapist.
Okay. And
they can reprogram the central system to kind of overwrite some of those missing files. So that's the importance of vestibular testing. Is, you know, we talk about vestibular function, but when we talk about vestibular function, we can't just say, I got the vertigo.
Right.
Like that vertigo is a symptom, even though it has its own CPT code, it's got its own diagnosis, or it is its own diagnosis. It is generally a symptom of something else.
Got it.
So vertigo is a symptom of benign paroxysmal positional vertigo or labyrinthitis or something like that. And so we have to figure out what's causing the vertigo.
In your practice, you have vestibular.
Yep.
And I have been able to bear witness to a few practices that have the chair.
Yeah.
The chair to me sounds daunting when I say it, like the chair.
Yeah. Like we're electrocuting people.
Yeah, very much so. And the setup to it you could actually easily convince somebody that they're going to be electrocuted afterwards.
True.
But with the goggles and the movement of the chair and the moving it backwards and moving it forwards, I know that we do not have a ton of time to discuss all of this, but when somebody is having an issue with balance and they come to an audiologist who has a vestibular element to their practice, and they get to sit in the chair and go through all the crazy things that make your eyes dance all across the screen, what is the best way for somebody to kind of prepare for that? Because it is entirely unique outside of an amusement park experience.
So I tell patients all the time, we have to make you dizzy in order to find out what's making you dizzy.
Got it.
And so the reason that you get dizzy during some of these evaluations is because something is disordered.
Sure.
Right? If you had a perfectly functional vestibular system, you wouldn't have any reaction to the testing. In theory.
Yeah.
Some people just have really like hyperactive vestibular systems and they do go, whoa, this is a lot. So to your point, the chair, it's rotational testing. It's a rotary chair, and it's generally considered to be gold standard in terms of determining whether it is a peripheral vestibular disorder that is bilateral.
Okay.
So what we have up until this point is we have caloric irrigations where we're changing the temperature of the middle ear space, which the point of doing that is to change the temperature of the fluid in one of the semicircular canals. This might be like a part 2, part 3.
Yeah. This will be a continuing series where we talk about vestibular once a year on Balance Awareness Week.
Yeah, you could probably do it a lot more than that.
For sure.
I know I could. But what we're doing is artificially telling the brain that you're turning around in a circle. So that's caloric irrigation studies.
So it's like doing like the bat on your forehead spin around thing, but in a chair.
Yeah, exactly. And what we're doing is we're monitoring eye movement. So we want to find out what kind of signals are getting up to the brain. Now, the difference between that and rotational chair testing is rotary chair testing is done under goggles in the dark. So the patient is strapped in a fairly unique posture. It's tilted forward about 15 degrees. Okay. And then they have goggles that are then Velcro strapped to the head of the chair.
Think of VR goggles.
Yeah, exactly. They can't, like big ski goggles. Yeah. They can't move their head this way or this way. We have to keep it in a similar plane. And then the chair does all the movement, and we record eye movements in relationship to those movements.
Got it.
It's such an interesting process because what we get to see on our side of the testing is how the vestibular system is sending a signal to the brain, how the brain is sending a signal to the eyes to catch up. It's the visual ocular reflex that we're measuring. Yeah. And in those disordered patients, we can see changes in the vestibulocular reflex that alludes to what's happening and what's going on. So really all the testing, and that's one part of the testing that we do in our clinic anyway. And you want to make sure that you're, for all of you consumers out there, you want to make sure that you're going to a clinic that has a comprehensive battery and they're not just doing 1 or 2 tests, because oftentimes we're missing a whole bunch of stuff on the periphery of what we can and what we have the ability to test. And their insurance covers these tests in most cases. And they can pre-authorize these clinics that do it for you. But it's so important to have that really comprehensive evaluation so that we can then provide guidance to the therapists.
So we have a minute left.
Yeah.
Give me, for in honor of Balance Awareness Week and people who are struggling from that, what is your professional opinion? Obviously that they still go talk to their own provider first, but what is the thing that you would recommend that everybody do who is suffering from something like this?
So first and foremost, talk to your primary care physician, right? Some insurances still require a referral, so you want to make sure that you go through your primary care physician and find a clinic that does comprehensive vestibular testing. Comprehensive meaning they're not just doing 1 or 2 tests within a full battery. And this is out there. You can Google this stuff, or you can send an email directly to Kevin and he'll tell you what comprehensive is.
Yeah,
but
I'll look it up.
But if you can find it just as easily as
I'll Google that. I'll Google that for you anytime.
But if you get a comprehensive evaluation, then if therapy is warranted, that audiologist can provide guidance for therapy, and it's so much more effective, and it's faster therapy, and you get better more effectively and a lot faster.
For anything else related to balance or vestibular, please visit askanaudiologist.com and use this week to be the spotlight for the help that you need in and around your own life with your friends and your family. And please go seek your own personal healthcare provider who can start you on that journey if you are not fortunate enough to live in the state of West Virginia where Dr. Michael resides. Dr. Michael, excellent job.
Oh, thanks. We love vestibular. Be aware.
We love it.
We're aware of it.
We'll see you guys next week.
Take care.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.